Well, February is National Heart Health Month, and about 2,300 Americans die of cardiovascular disease every day. We're talking about one every 38 seconds. And what's more, heart disease is the leading cause of death among women in the United States, claiming the life of about one woman every 80 seconds. With me now to discuss heart health and its implications among women, Dr. Stephen Reisman, a cardiologist at the New York Cardiac Diagnostic Center. Doctor, thanks for joining us.
Thank you.
You know, this is a sad topic, but it's great that we talk about it because understanding and prevention is certainly a key, and the public still needs a lot of education.
Yeah, you know, we're very proactive in making sure that men and women, particularly women, get screened for heart disease. Women can have atypical symptoms. They can have fatigue, not necessarily chest pain, shortness of breath. We have a brochure in our office called Women and Heart Disease at the New York Cardiac Diagnostic Center, and when it's online also now on our website. And the important thing is to be thinking of women with atypical symptoms, and especially if they have risk factors such as diabetes, hyperlipidemia, if they have hypertension, a family history of heart disease, obesity. These are all things that you have to be very, very aggressive about preventing.
How critical is it that you get diagnosed and treated? Like, in other words, is it a year or 2 years before you might have had a heart attack? And in other words, we know that the clock is ticking and that there's a sense of urgency. I know for men miss those things. I'm loath to go to the doctor unless I really am in some form of pain or discomfort.
Well, the women have to be really aware of these unusual symptoms. Extreme fatigue, if they have shortness of breath, even if they're restless and sleeping not well at night. There are a lot of early warning signs in women that are different than men.
But that could also be conflicted with other things, though, right? You can conflate them and think, well, it's this, it's that, it's this. So, again, the awareness to say, hey, it could actually also be this, and I need to go see and talk to someone about it.
Well, all they need to do is make an appointment with a cardiologist, like a cardiologist here in New York City, and all you have to do is come in for an hour. What we usually do is an ultrasound of the heart, an echocardiogram, and a stress test. And usually in many of the instances, that'll pick up something that's going on. It includes an electrocardiogram, how your blood pressure and heart rate do during exercise, how your heart functions on an echocardiogram, and then look at risk factors such as, blood tests.
Right. You mentioned diabetes earlier. Of course, we know the obesity epidemic in this country, despite all the publicity that it's gotten, hasn't really slowed down at all. Where do you say the number one factor is, particularly preventable factor?
Well, with obesity, I think what's happening in the country is people are not exercising, they're sedentary, they don't have the right diet. Every patient who comes to our office gets a program of exercise, 30 minutes a day, 5 days a week of vigorous walking, Mediterranean diet, first a weight loss diet, and then go on a very heart-healthy diet, a Mediterranean diet, and you can look on our website, you can Google it. These are lifestyle modifications.
What's your website, by the way?
www.newyorkcardiac.com. And you can go onto the blog area and type in women's health, for instance, and find out about women's health and heart disease.
Dr. Reisman, thank you very much.
Thank
you.
Really
appreciate it.